Hello and welcome to yet another episode of Health Business. This episode is special, yes, special in the sense that we are right here in Umuahia, the Abia state capital, for the 90th annual conference of the Pharmaceutical Society of Nigeria. You get to watch everything concerning the conference right here on Health Business. I'm your host, Oluwatoyin Kolawole. Glad to know you are still watching Health Business. Like I mentioned earlier, Health Business is in Umuahia for the 90th annual conference of the Pharmaceutical Society of Nigeria. Sit back, relax, and enjoy this report about the conference.
More than 5,000 pharmacists and scientists from Nigeria and diaspora gathered in Umuahia, the Abia state capital, for this year's annual national conference, the largest gathering of pharmacy professionals that marks the 90th anniversary of the association. The conference began with a medical outreach to Ubakala autonomous community in the state, with 7 doctors, 20 nurses, and 40 pharmacists screening for different diseases. There were free consultation and counseling. Free drugs were also given to people. The traditional ruler of the community, who welcomed the Pharmaceutical Society of Nigeria delegation, commended them for bringing free health care to their doorsteps.
Our organizing chairman of this conference is given the title of Onye Njikọta Ndị Ọgwụ. Onye Njikọta Ndị Ọgwụ. Unfortunately, the regalia and other things, I don't know what is keeping them. I think we have the same problem with you. There's a break in communication. We are supposed to have been here, but I think we gave them 1 o'clock.
The pharmacists then moved to the government house, where they were received by the executive governor, Okeze Ikpeazu. The president of the Pharmaceutical Society of Nigeria, Ahmed Yakasai, urged the governor to strengthen the healthcare delivery of the state by employing more medical personnel.
What I observed since I arrived into Umuahia is the hospitality of the people. They have large hearts, I have said it. The wholesale coordinated center is going to be established in 4 states: Abia State, Kano, Anambra, and Lagos. And most of the states have given certificate of occupancy. And I understand they have the land here at Aba. Yes. And Enyimba Pharmaceutical and Allied Company Limited. And they are waiting for the release of the certificate of occupancy.
In his response, Governor Ikpeazu agreed that there is a lot to do in the health sector, though he noted that the government has worked tremendously in reducing maternal mortality.
It is about improving our health indices as a people. And if we want to do something about life expectancy, we must be able to guarantee stable health for our children from 10 to 59 and their mothers, and also look forward to a day when should we lose any child at childbirth, Mr. Governor will be informed about why and how that child died. And then on the other extreme, our aged parents from 70 and above, maybe too weak to go out there to cast their vote. But yes, improving and stabilizing their health also, put it together with the making children more stable, you will notice that we can do something about our life expectancy, and that is the ultimate goal of this administration.
Then the pharmacists embarked on a sensitization work against hepatitis.
The essence of this work is to create a sustainable awareness against hepatitis.
On Tuesday, October the 7th, the conference was officially opened. with the theme Medicines Availability and National Security. Speakers after speakers highlighted the importance of closing down illegal drugstores as well as open drug markets.
We want to talk about the manufacturing. We want to talk about the distribution. We want to talk about the way we give it to the final user, the consumer or the patient. We want to talk about rational use of medicine. We want to talk about what steps we need to begin to do to make sure that we make more medicines or medication available to Nigerians in a way that it is more accessible, it is more affordable, and it can be accessed at everywhere, wherever they are living, whether in the rural setting or in the urban setting.
Drug and security are the same. Nearly everybody consumes some amount of drug in their life. So improper drug, fake drug can affect our life. I think organizations like PSN, working with established medical associations like NAPSA, like the Pharmaceutical Council, like the federal government, can do more than they're doing now to bring about good drug delivery, good drug management, and good drug consumption.
I'm expecting a great scientific exposition where people will learn more about drugs, learn more about pharmacists, learn what pharmacists do, and then on a personal level and on a state level, I'm expecting an injection of a lot of money into the economy of Abia State.
We keep sending the signal. It's a democratic dispensation where liberties are almost open-ended, and you must continue to promote rules, the finest tenets of rules of engagement, and we continue to do that with all stakeholders in the pharma industry, including operators in the drug markets. I have no doubt that ultimately the spirit of the new national drug distribution guidelines will prevail.
It goes a long way when the drugs are always available at the right time, at the right place, and for it to be available for everybody to be able to do. And when it is available in a way that the whole environment benefits from it, it will improve the security of even the nation, because a lot of people are exposed to the right drugs. And then it means that it has to be available where it should be, where people that are known to be custodian of the drugs, that can take authority over the drugs.
In his remark, the president of Pharmaceutical Society of Nigeria, Ahmed Yakasai, highlighted the challenges facing the health sector, which include delayed and unlawful appointments in regulatory agencies, poor composition structures in the health sector.
If we can give an enabling environment for local production, definitely we will be able to have security as far as medicine is concerned. The availability, the quality, the affordability, the accessibility all come together to bring about the security. If you are just importing, somebody somewhere can organize anything, can finish the whole country through that. That's why we're saying, let's do it ourselves. At least 70% of our own consumption should be produced locally.
It is believed that this conference will achieve the desired result if the government ensures that all illegal drug markets are shut down and all drugs should be sold based on prescription.
Well, I'm sure you enjoyed every bit of that report. Up next is the concluding part of male infertility with Dr. Abayomi Ajayi.
Welcome to Understanding Infertility. My name is Dr. Abayomi Ajayi, and today we're going to be discussing something very interesting: male infertility. How can we treat when the sperm parameters are not at par? We can look at this from three different views: drugs, surgery, and assisted conception. For the drugs, well, unfortunately, as of now, there's still no sperm boosters. So when the sperm count is really low, then drugs, as of now, cannot really help. When the sperm count is low or not there at all, the only thing that is proven to give remedy, it's assisted conception. And you know, the first assisted conception was what we call IVF, and that's why up till now we still call everything IVF under assisted conception. But we know that there are so many spin-offs of IVF, and one of them for male infertility is what we call ICSI, or intracytoplasmic sperm injection. What this simply means is that we just take one sperm and we inject it into one egg. This is of course done under very high magnification and requires a lot of skills from the people who are doing it, the embryologists. So this is where actually the rubber meets the road, where you need the skill of the clinic to be able to do this. From 2004, other things like IMSI, which is an advancement on ICSI, have also been introduced. What this also means is that in ICSI, what we do, you know, I told you we magnify the sperm to times 200 or times 400, but in IMSI, we actually magnify to about times 7,000. So we are able to see all the various parts of the sperm. And one frightening thing that we saw was that a lot of the sperm had holes in their heads, which are not normal sperm, which we should not use for fertilization. And that was why when we started with ICSI, we were beginning to fertilize a lot of eggs, but we were also having a lot of miscarriages because we were just simply using sperm that normally we not fertilize to fertilize the eggs. But with IMSI, we're able to pick and choose the ones that are normal and the ones that are not normal. Sometimes there's some things that you can do to prevent having low sperm count. If you have not already had it, there's some things that you can do to prevent it or to preserve your fertility as a man. But what we say most of the time is that diet, you eat healthily, make sure that you maintain a normal BMI or body mass index, not to talk of hard drugs. Excessive alcohol also depresses sperm count. Caffeine should be limited to not more than 2 cups per day. Anabolic steroids, that is the drugs that people use when they want to develop six-pack, definitely destroys the warehouse of the factory for producing semen. One other thing that people ask all the time is about this underwear, the controversy between boxers and pants. Yeah, boxers are better, no doubt, but does not mean that because you're wearing boxers you can't have male fertility. Like I said, the only thing is that you must do tests to find out whether there's an issue or not. I think that's what where we're going to round up today. We'll see you next time. Remember, together we can conquer infertility. My name is still Dr. Abayomi Ajayi. Catch you.
I'm sure you agree with me that this week's episode has been very informative. Well, join me again next week for a fresh installment. My name is Oluwatoyin Kolaole. Remember, living healthy is a serious business. Bye for now. Thank you.